Ladies and gentlemen, the scientific literature linking exercise and sedentary behavior to a range of physical and mental health conditions is strong and rapidly growing. But of course, this audience, you're here because you don't just believe that physical activity or physical inactivity rather is a risk factor for chronic disease. I believe you're already far beyond this stage. You are here, we are all here today to claim, to support emphatically that exercise can be medicine. And within this context, I have received this very kind invitation, for which I thank Professor Filippo and the organizing committee, to present levels of physical inactivity in children and adolescents in Greece, and also to inform you about some recent developments in relation to national strategies, action plans, measures that are currently being implemented in our country. To present to you data on physical activity and inactivity among youth in Greece, I will use two large population surveys. The first one, the Health Behavior in School-Age Children Study, is a multinational cross-sectional survey which is conducted by the Scientific Institute of Mental Health, Neuroscience and Precision Medicine in collaboration with the WHO Regional Office for Europe. The survey is carried out every 4 years since early 80s across Europe and North America. The second large population survey data come from a project, the EFSIN project, the National Action for Children's Health Program, which is a nationwide school-based survey performed under the auspices of Hierokopion University. And those who are not familiar with the Greek conditions, Hierokopion is the university who is primarily responsible to provide nutrition education in health professionals, and the Hellenic Ministry of Education. The first one, the Health Behavior in School-Age Children Study, aims to gain insight into adolescent health and well-being and inform policy and practice to improve young people's lives. To select participants, the researchers apply a random cluster sampling design, with schools being the sampling unit. So all types of schools, being comprehensive, vocational, public, private schools, are eligible to participate to achieve a representative sample, not only in relation to types of schools, but also in relation to locality. Just to give you an example, in the 2018 wave, out of the schools selected to participate, 93% responded positively, and in these schools, students 11, 13, and 15 years old were invited to take part in the study. And the selection criteria from the schools is students, children, adolescents 11, 13, 15 years old, which corresponds to specific grades in our educational system. The data collection includes self-administered questionnaires, which are completed in class with the help of a trained researcher to assess physical activity based on the moderate WHO moderate to vigorous physical activity questions, and also questions on sedentary behavior through 3 questions on typical screen-based and sedentary activities during free time. The second one, and I will bear myself from many details because I understand that Professor Tambalis later on will provide you with more information on methods and results from this survey, aimed to record health and lifestyle-related parameters of the student population in Greece. The sampling frame was very simple and elegant. No one was excluded. All public, private primary schools could be included in the survey sample. And in 2014, more than 470,000 children and adolescents 4 to 18 years old participated. In 2015, more than 170,000 children, adolescents 8 to 17 years old took part in the study. The study included self-administered questionnaires on physical activity, sedentary behavior, and dietary habits, the Eurofit physical fitness test battery, and anthropometric measurements. And let me point, let me pause a bit on the last point, which is very important, to have measured anthropometry, to have measured weight, height, and waist circumferences of our children and adolescents. Now, this infographic combines data from both surveys I've just described. As you understand, the data on 4 to 12 years old come from the EFSIN project, whereas the data for 13 and 15 years old come from the HBSE study. Probably I have a pointer here? Yeah, I do. Okay, according to the wave of 2014, for both surveys, around 60% of children and pre-adolescents reported sufficient physical activity levels, and among participants for which the researchers had information on their sex, 62% of boys and 65% of girls reported sufficient physical activity. The percentage dropped dramatically in adolescents. 14% for 13 years old, 11% for 15 years, more boys than girls. A change also in the sex distribution of physically active adolescents. According to data of the same period, physical activity in 2015 was promoted either through mandatory hours during courses, 3 hours in primary schools, 2 hours in secondary schools, and through physical activity after school. A couple of years later, similar infographics, this time relying on the HBSC of 2018. This is why you cannot see data for children, and the graph refers only to adolescents. For 11 years old, 21% reported being physically active, slightly larger from 14 to 15, from 11 to 13, very small increases, but a slight increase in the percentage of physically active adolescents according to this study. And again, more male adolescents and female adolescents are engaged in physical activity initiatives, in exercise. During this period, the mandatory hours are common in both primary and elementary school, 2 to 3 hours mandatory PE education. And now physical activity is not only promoted after school, is also promoted during breaks, and at that time there was this eco-mobility project carried out in the country, and one component of the project promoted transfer from to and from school, also as a way to enhance physical activity. A table which I'm sure Professor Tambalis will comment upon more in his presentation, simply to show you some descriptive results from the 2015 sample, among other things, physical activity and sedentary time, screen time, less than 9 hours per day, screen time a bit more per week, a bit more than 9 hours per week physical activity, according to data coming from the EFSIN project about 10 years ago. And the most recent data come from the last wave, the 2022 wave of the HBSC study. In spring 2026, a new wave of this study is going to take place, so new data are going to be collected. According to 2022, in which more than 6,200 students participated, the age criteria are always the same. Data collected between October and December 2022, and according to this data, only 18% of adolescents in Greece met WHO recommendations. In addition, about 1/3, actually 30.4% of Greek adolescents were their physical activity led to evidence of actual physical inactivity. About 1/3, they were physically inactive, and keep in mind that the international average of that time was 24%. Girls, again, were more likely to be inactive than boys, 37% of girls and about 23% of boys. And overall, this pattern remains constant for adolescents. Inactivity rate increased with age. Excuse me. The evidence was alarming. Something needs to be done, and this is why recently the Hellenic Ministry of Health, together with the UNICEF office in Athens, launched the National Action Against Childhood Obesity. And of course, one cannot tackle childhood obesity without addressing nutrition and physical activity. And in this slide, you see the 5 work packages of the whole program. The first work package on legal framework aims to investigate the current framework and propose changes that could enhance healthier dietary choices and more physical activity among our youth. Work Package 2 aims to primary prevention, and through this work package, for the last, I could say 1 year, but actually we started in March, so it's less than 1 year, aims to promote interventions, community interventions in school children. Work Package 3, secondary and tertiary prevention, and those in the audience living in Greece, you may have heard about the program which can prescribe dietary advice to obese children and adolescents, so they can receive dietary advice for free for a period of 6 months, if I'm not mistaken. Work Package 4 aims to address gaps in knowledge, so health literacy to be achieved, health communication to be more efficient. And Work Package 5 aims to develop digital tools. The tools will be developed, will be pilot tested during the course of this project. We are looking for ways to have this work package going on to be more sustainable, applications to monitor and to support children and adolescents in their choices. For the rest of my presentation, I will present to you actions related to Work Package 2, and here is a poster describing the 4 pillars. Pillar number 1 aims to achieve adequate water intake and to lower intake of SSBs, the sugar-sweetened beverages. Pillar number 2, adequate physical activity. Number 3, on healthy choices for breakfast and school snacks. And 4, reduce time spent sitting and screen time. And I will focus more on pillar number 2 and number 4. And please allow me to spend 1 minute to thank in public Professor Nassis for supporting us in communicating these messages to coordinators of educators, teachers and professors of elementary and secondary schools, to children, to their parents, to their caregivers. As I told you, this is a currently going on intervention which takes place not in the mainland, but in all the big cities and beyond the mainland, but also in the islands. It is a country effort. This is the site where those among you speaking Greek, you can retrieve more information. You can even download the tools that are proposed to be used by the general public and the children educators, and you can use the QR code to enter the site just now, as you wish, and I'm very happy to see your phones using the QR code. There is a choice in the site which provides access, Ergaliothekes in Greek, provides access to all the tools that are available in relation to this primary prevention, intervention, strategy and program. To give you some examples, in Pillar 2, to promote physical activity, suggestions fall under 5 domains. To shape a supportive physical environment, like transforming areas in the school, like the event halls, which are not regularly used in a school day, into places where children could exercise or play, and include posters to enhance, to nudge children, to promote, to be more engaged into physical activity actions. Number 2 provides examples on how to implement a supportive social environment, suggesting to teachers to come close students that have similar sports interest, carrying out activities, and I will show you some examples in relation to that. And of course, one cannot go without the support of the families, so there is a pillar and many tools available in the web page on active participation of parents and caregivers. Just to give you an example of carrying out activities, we're trying to explain to our teachers that children do not sit down all the time to have their class going on. And this is an example you can find in the website and other similar examples in relation, for instance, to geometry class. So I read what the site, what the tools propose to the teacher. The teacher tells the student, as you listen to the music, you will move around the space by walking. This, of course, demands that the desks are moved at the side of the class for this geometry class. Each time the music stops, you will freeze and look in my direction. I will show you a shape, and each of you will try to form that shape with your body, and then tell the name of the shape. And another example for pre-elementary children. Are you ready for a dance party? Grab your water bottles, come and join me. Because you know, a huge bet for the Greek society is to persuade our children and our adolescents even more that when you are thirsty, you drink water. You don't drink beverages to ease your thirst. And this is very, very important. This is my last slide, but I will spend some time on it because it relates on Work Package 1, the legal framework. And I hope, Professor Nasis, that could be food for thought for your presentation, because what you're about to see is some points from focus group discussions that the National Institute of Social Sciences carried out in the context of this project, UNICEF and Ministry of Health project, trying to understand weak points in our legal framework and suggestions to address these weak points. So they performed a huge spectrum of focus group discussions with a variety of stakeholders, and from the report I grabbed bits and pieces that are related to physical activity. So let's see what the stakeholders told. Actually, the focus group took place October 2024. This is what they told, this is what they proposed last year. They proposed that the role of physical education course, the PE course in students' development, can highlight the need for a shift from general physical activity, and they proposed a more comprehensive health education. They specifically mentioned that we can provide nutrition education to our students during the PE course. We can provide health-promoting education, and this is a wonderful idea. But what we need to find out in relation to the legal framework is whether the PE teachers are adequately educated to provide this training and this advice to their students. This is a very interesting point. No grades in the physical education course, because in Greece, children get a grade. And this, and now I speak as a mother more than a scientist, this personally I do not understand. Why to grade an effort? Why, I will not talk about encouragement, why to discourage some students by going into this effort? Because I have to tell you that according to the law, children have the right to be exempted from the course. So if they feel that they are not treated adequately, if they feel that their teacher has misjudged them, they will lose this opportunity for 2 to 3 hours physical exercise during class, simply because they don't want to get into this loop of receiving a grade for the course. And that was almost a unanimous agreement from the stakeholders, an agreed proposal from the stakeholders participating, and there were physical education teachers among the focus group participants. They also proposed to having exercise and physical activity prescribed by pediatricians. And this is an interesting point because sports after school do not go without cost. And in a country that has recently experienced the financial crisis, financial issues are to be considered. They also proposed the necessity to increase the availability of open spaces for both organized physical exercise and free play. upgrading and utilizing school facilities when the school day is over. When the school day is over, most schools in Greece are locked. It is in the hands of the municipality to decide whether to keep the school open or not. And in this way, because schools are in the center of local communities, children and adolescents miss the opportunity to use the basketball fields, the volleyball fields, or even to use some safe open space for their play. And what is even more striking is that we have these open space playgrounds, and they are locked between 2 and 5. In a country where we are privileged to enjoy excellent weather, if a child comes back from school and does not want to do the homework immediately, and they want to spend some time playing in the playground in the neighborhood, they cannot because it is locked, because there is no guard available during this period of time. And it's okay if it's summertime and it's still bright light after 5, but in winter at 5:30 it gets dark, or at least it starts to get dark. So why to lock the playgrounds in this period from 2 to 5 when children are back at home? And these are, you may think that this is common sense, but as important people say, common sense is not that common. And we have a meeting with the legal department of the ministry next week to discuss all these proposals and to see how this can be integrated into a new legal framework. Another striking, at least for myself, discovery related to schools outside big cities. In Work Package 2, in relation to primary prevention, we are providing examples to educators on how to keep children in schools after the school day, to provide nutrition education, education related to exercise and physical activity. But there is a school that supports many different villages. And around 2 o'clock, the bus that will take children to their villages has to go, which means that even if the children want to stay longer to get this extracurricular education, or even to use the open space of the school for some exercise, this cannot be done because there is only one bus per day and it goes at 2. This is another issue that, again, can have legal solutions, if I dare say that. And of course, nobody disregarded the role of parents. Parents, guardians, caregivers acting as role models, which means that any action, any measure for children and adolescents needs to go hand in hand with enhancing, promoting physical activity also for the adults. And I will close my presentation with some pictures from a health festival we held in the last weekend of September in the context of Work Package 2. This is in a local community in Athens. 600 individuals living close to this park, they came to the health festival. I chose this picture of parents and children all playing basketball because this man here with a white shirt is the Deputy Minister of Health. He used to be a basketball player. He plays very good basketball. The children were very happy, but most importantly, he persuaded parents to play basketball with their children. And we tried to be inclusive. We were trying to give new ideas to the family of exercise, of I could say sports, of things they can do with their children that are not very demanding, but at least they can use their time on a Sunday morning to perform these activities. And this is, of course, boccia sport, and we invited individuals who are at the margins of the society, and children played, all of them, they played together. And of course, we addressed issues in relation to their nutrition, and we gave them the opportunity to plant their own vegetables and their own herbs. And with these very nice pictures and with an ambitious message, I wish to thank you all for your attention.